Hi, Dr. Lindsey here. This is an interesting video in that it's a 28-year follow-up on 2 short scar facelifts by me on the same lady. So my son's 27, and I think when my wife was pregnant with him and we were living in Charlottesville, Rhonda came in to see me, and this was before digital cameras. And so the pictures that I'm going to show you are pictures of real print things. That's why the resolution is not as good. So Rhonda looked like this, and I did her revision rhinoplasty. She's a tall lady. She's probably my height. I'm 5'11", and she subsequently won Ms. Virginia. And her husband is an interesting character who I got to be reasonably good friends with. He was a federal marshal at the time. And then we did a short scar facelift on her, I think in 1998, after the Miss Virginia contest. And she was 45 or so at the time, just a little tweak. And then I've seen her a number of times over the years. We moved up here to Northern Virginia in 2000, and she's come up for Botox and things over the years. And then a couple of years ago, she wanted a little tune-up. And so I did a short scar facelift on her under local anesthesia with liposuction of her neck. And here she is before. And then here she is after at a week. And then she sent me a variety of pictures. But here are a couple of screenshots of her selfies and her publicity shots. She's still doing a contest in the beauty industry. So some people think that the short scar facelift doesn't do enough, and some people think you ought to do something much more radical. And for some people, it does not do enough. But this lady's perfect for it. She's got a nice, strong chin, and the bone that your tongue sets on, called the hyoid bone's up high. She's angular featured, and she's got good skin. And so for somebody like her, there's no need to do something major. We can do a short scar facelift under local anesthesia and with a little Valium in about an hour and 15 minutes. I've done about 4,300 of these without any significant complications, such as facial nerve injury. And typically at 6 days or so, you look pretty good, and the scars typically fade really well in almost everybody by about 6 weeks. And so this is a good example of a mid-70s woman who's had 2 of these procedures with me and is still holding up well. I've done procedures like this on people as young as 35 or 40 and as old as the early 80s. And with proper patient selection, meaning people that understand the limitations and have good anatomy, this can be an excellent alternative to a more invasive and radical procedure. If we can help you, please give me a call. Thank you.